Hi, this is Professor Tagwire again, and during this lesson, I just wanted to talk about scorpion sting in Zimbabwe. And whilst this lecture has been made specifically for my Bachelor of Pharmacy Honors final year students in their clinical pharmacy / toxicology class, you're most welcome to go through and learn, even if you are from other professions or even if you just want to learn about scorpion sting. Let's move. So the learning objectives, the three main objectives really, by the end of this lesson, learners must be able to demonstrate an appreciation of the importance of scorpion sting in Zimbabwe, and then also must be able to describe the scorpions that are responsible for medically important scorpionism, as well as the converse of that, to know which scorpions would result in stings which do not necessarily require any medical attention. And then thirdly, students or learners must be able to describe the management of scorpion sting in Zimbabwe to be able to advise anyone who might want some assistance with regards to the management of scorpion stings. So as a way of introduction, scorpion sting is quite an important medical issue, especially in subtropical and tropical regions of the world, especially in North Africa, Latin America, India, as well as the Middle East. We've got statistics in the literature which cite approximately 40,000 stings per year in some countries like Morocco. And fortunately for us here in Southern Africa, scorpionism is not such a significant issue. Although there have been fatalities which have been recorded in the literature here in Zimbabwe as well as other parts of Southern Africa. Not just fatalities, but also severe scorpionism. And then as a general point, as we go further, the venom of scorpions is neurotoxic. So it's unlike that of snakes where you do have cytotoxic envenomation and other things like that. The scorpionism is normally associated with neurotoxic envenomation. So we've got three major families of scorpions in Zimbabwe and in Southern Africa, indeed, I believe. So the first family are what are called the thick-tailed scorpions, and we shall spend a bit of time talking about these because the medically important scorpions belong to this particular family, especially the Parabuthus genus, which has got scorpions which are responsible for most of the fatalities that we get from scorpion sting. There's another family, the Scorpionidae, which consists of the burrowing scorpions, as well as the Homoreans or Homuridae, which consists of the rock and tree scorpions. And we shall talk briefly about these other two families as well. So these families, the venom of most scorpionids as well as Homurids is not very toxic to humans and ordinarily results in just local effects. Although, as I shall probably mention a bit later, we have one family belonging to the scorpionids, Opistophthalmus glabrifrons, which has been reported by Bergman, I think in 1997. He reported some cases where there was systemic envenomation after stings from these particular scorpions. And like I said earlier, the Buthid family is the one which has got the medically important scorpions, and it is from these that we normally get systemic envenomation. So there's some factors which are associated with scorpion stings. You see, if I stay perhaps in the central business district where the roads are tarred, probably there are no trees or very few trees, very few rocks around, the likelihood of me encountering a scorpion is pretty limited. So that is what I'm talking about, and I'm talking about factors. What issues, whether environmental, social, or otherwise, increase the risk of someone being stung by a scorpion? So I've already mentioned the issue of locality, but then also we've got the issue of time and season. So scorpion sting is normally rife during the rainy season here in Zimbabwe. So we're talking about October perhaps, November, December, maybe January, February. It depends on the rainy season. But whenever it's raining, scorpions come out to forage for food. And that is when encounters can actually happen with human beings. And then we've got other issues, like gender-related activities. Here I've got someone picking up some firewood, and we've got some scorpions which like, hiding in where there's firewood. And therefore, if someone is involved in this activity, their risk of being bitten by a scorpion will be much higher than somebody perhaps who is not engaged in a similar activity. Then also the types of scorpions. As we shall see later, in the bothed family, we've got pretty aggressive scorpions which actually sting quite readily. Yet for other scorpions, they may not sting that readily. So the type of scorpion also will determine whether scorpion sting will occur or not, as well as some of the issues which I've mentioned. So with regards to severity of a scorpion sting, it will depend, on the scorpion or the patient. So those are the two major variables that you look at. So the size of the scorpion is quite important because the bigger the scorpion, the larger the venom stores or venom gland, probably the longer the sting, therefore the deeper the venom will be deposited into the body, and thereby we expect more serious intoxication with larger scorpions as a rule of thumb, if it is the venomous ones. And also the type of scorpion which is involved. If you have the smaller Uroplectus, as you shall see, the envenomation might not be as terrible as that of the Parabuthus species. Then patient characteristics are the same usual things that we spoke about when we were introducing our toxicology course. So the age of the victim might be important. As a rule of thumb, the younger, the infants and babies, are more at risk of suffering serious envenomation compared to adults, as well as also the other end of the pendulum, or the other of the spectrum, where we also get the elderly also being at risk of suffering serious envenomation, as well as the bite side nutritional status of the patient, medical status of the patient, including the drugs that they're on, as well as other factors which students can actually look into. So in terms of identification of venomous scorpions in Zimbabwe, we'll start probably with just, it's a simple rule of thumb which is applied in Southern Africa, that if a scorpion is large, as we have here, Hydrogens, which belongs to Homoreans family, and it has got a thin tail, a slender tail, and a robust or large pincers or pedipalps, as well as a flat body, chances are high that this will be a non-venomous scorpion. On the other hand, if the scorpion is large, 8 centimeters, 9 centimeters, thereabout, and has got a very thick tail and thin pincers and a robust-looking body, chances are high that then this would belong to the Parabuthus species, which are thick-tailed, and this would likely be a venomous scorpion. But we shall talk more about this when we get into the various families and species within those families. So let's start with family number 1, which is the Butheid family that I've labeled the thick-tailed bunch. And the picture which I have here is pretty representative of the scorpions which belong to this family. And you tell them by the thick tail, relatively thin pincers. And the one which I have here is Parabuthus transvalicus, which I shall talk about also a bit later, found largely in the southern parts of Zimbabwe and Lowveld. Let's move right on. So this family has got 6 genera in it. So this is the Butheid family, or Buthidae. And of the 6 genera, probably 3 are the ones that are of toxicological importance by virtue of how common they are, as well as how important they are medically or toxicologically. And the 3 are in an order of actually importance with regards to severity of signs and symptoms of envenomation. Parabuthus is at the top. So the Parabuthus genus, Hottentotta genus, as well as the Uroplectus, which would be the one with the least toxic venom out of these, or at least responsible for less envenomation. So the Parabuthus genus or Parabuthus species, there are 5 species that we have in Zimbabwe which belong to this particular genus. And we've got Parabuthus transvalicus, Parabuthus granulatus, Parabuthus rhodus, Parabuthus mosambicensis, and Parabuthus kaunyamarum. In general, these are exceptionally large scorpions, with some getting as big as 15 centimeters, even slightly bigger. And they have stridulatory granules or ridges on the dorsal, that's the last portions, dorsal surface of the first 2 tail segments. That's towards of the first two tail segments, and they make a hissing sound, you know, by scraping their sting onto these granules. And when startled, they have the ability also to spray venom into a victim's eyes up to about a meter, so literature has said. And in such cases, if venom is sprayed into your eyes from your snake bite lessons, then you would know that what you need to do is to then rinse with significant copious amounts of water, probably up to 20 minutes or so, making sure that the affected eye is always at the bottom and you wash from the unaffected to the affected. So in terms of some characteristics, the Parabuthus species is quite an aggressive species, and they will not hesitate to sting if threatened. And when disturbed, they raise their abdomens off the ground like that and curl the tail, ready to peck or flick the sting and give someone a nasty sting. So the ones that we have here in Zimbabwe, so between Parabuthus granulatus and Parabuthus transvalicus, in Southern Africa, these 2 species are the ones which are responsible for most cases of severe scorpionism or severe envenomation, and indeed fatalities as well. So if it's Parabuthus granulatus, we tend to find these in a very small section, the southern parts of the country, but more towards the western side of the country. So it's the southwestern parts of the country as they come in from Botswana. And then where Parabuthus, granulatus is not there, we find that we have Parabuthus transvalicus, although there's an area probably where you'd probably find both species around here. But towards the southern and eastern parts, as well as the southern low-veld parts, you would come across Parabuthus transvalicus. And interestingly, Parabuthus granulatus is probably got the most potent venom of all these scorpions, but it's probably, after a sting, it releases probably just about a third of what Parabuthus transvalicus does. Transvalicus, interestingly, even though the venom is not as potent as that of granulatus, does pack quite a huge volume of the venom. So stings from these 2 are actually of medical importance, and someone should seek medical attention after being stung by them. The other 3 species that we have are Parabuthus rhodus, which can go up to about 10 centimeters, pretty large as well. It's got a characteristic dark part at the last 2 segments of the tail, as well as the sting, and that's how it is. You can quickly differentiate it from mosambicensis, as well as the other scorpions. Found in a small part, it prefers the Kalahari type of sands, but there've been reports of it being found in the northwest parts of Zimbabwe, although it's not a very common scorpion. Then Parabuthus mosambicensis would be found in the eastern parts of the country, going down towards the low veld and also the southern parts of the nation as well. and it's between 60 to 80 millimeters. Is a highly venomous scorpion as well. And then this one is found in a very small part. Recently, not many sightings have been done of Parabuthus kuyanyamarum. It's actually strange saying it, but it's the smallest of the Parabuthus species that we actually have in Zimbabwe. And the venom, although neurotoxic like the others, by virtue of it being much smaller, it means it would probably pack a much smaller volume and therefore would not be as highly venomous as the Parabuthus mosambicensis, as well as Parabuthus granulatus and Parabuthus transvalicus. But for students, I think the ones that I would like you to just remember, especially Parabuthus transvalicus, and also have an idea of just the part of the nation where we find this scorpion, and also Parabuthus granulatus, and just know it's found more in the west, and probably also know Parabuthus mosambicensis, because this one is also found on the eastern parts of the country as well as south. And then the other two, even if you don't know them, it's fine, you'll still pass it. So in terms of clinical presentation, after someone is stung by scorpions which belong to this genus Parabuthus, there is pain of varying intensity to extreme pain, as well as moderate pain. So it really varies. And ordinarily, there is also swelling at the sting site. And then systemic effects are actually what are more common, and you'd get dysphagia, difficulty in swallowing or eating, hypersalivation, difficulty in moving your joints, ptosis, this will be your drooping eyes, numbness in the body, pulmonary edema, and death normally occurs as a result of respiratory depression. So just a bit more about the toxicology and clinical presentation. So like we said earlier, the venom of scorpions is largely neurotoxic. And they act on the sodium and potassium channels, leading to increased excitability. So you then have an increased release of noradrenaline, acetylcholine from the nerve endings, as well as adrenaline release from the medulla. And then the clinical presentation, by virtue of these, which are at the top, I know I talked about the clinical presentation in the previous slide, but just to make things clear, like you can actually have hypertension or hypotension, depending on whether you have more noradrenaline or more acetylcholine being released. You have hypersalivation, you have excessive sweating, fever, bradycardia or tachycardia, restlessness, facial palsy, facial paralysis, tremors, dyspneas, difficulty in breathing, and death occurs as a result of respiratory. Now, for this one in particular, I wanted to also talk about the issue of envenomation in children, because although the signs and symptoms are similar to those of adults, in addition to the signs and symptoms that we talked about in the previous slide, you find that there is some strange syndrome which occurs in children, which the medical profession up to date has described as being pretty unique to scorpion sting. And you get some unique form of restlessness, which is characterized by the child crying and screaming, and the child just won't keep still, and it's very difficult to control. And the child has got uncontrollable jerking of the extremities, chaotic thrashing movements, flailing, breathing, and they are unable to lie still. They're quite difficult to restrain. To this, priapism has also been reported in children. So that is, erection in male children. So with regards to the management of scorpion sting, most of the management, at least as we begin rudimentary, is towards pain and local anesthesia with lignocaine or bupivacaine with no adrenaline. Because remember, we said that in the mechanism there might be an increase of adrenaline from the medulla. So you don't really want local anesthetics with adrenaline as well. So this must be diluted with an equal volume of water for injection. And Bergman, in his PhD, found that this was quite an effective treatment in terms of reducing pain at the bite site. So it is then injected or infiltrated at the sting site. And simple analgesics like your paracetamol can be given. We want to try and avoid opioids. Why? Because they are central nervous system depressants. And like we noticed, death normally occurs as a result of respiratory depression, which is a consequence of CNS depression as well. So opioids are ineffective and increase the risk of respiratory depression. And then in severe scorpionism, there is an antivenom which does exist, which is made by the South African Institute of Medical Research for the Parabuthus species, which covers basically your Parabuthus transvaricus and Parabuthus granulatus, which are the ones that we are more concerned about here in Zimbabwe. And if anaphylaxis does occur, I mean, adrenaline has been found to be quite useful in dealing with it. Bergman also talks about hydrocortisone as well. Antibiotics are largely not recommended prophylaxis. So that was the first species or the first genera that we had, which was the Parabuthus, which has got 5 species in it. The second genera is Hottentotta. And for this one, there's one particular species which is found at least more commonly in Zimbabwe, and that's Hottentotta trilineatus. Hottentotta trilineatus. And it's a medium-sized scorpion up to 6 centimeters, quite robust looking. If you look here, not a slender, pretty robust looking, thin pincers, and a thick tail as well. Can actually be mistaken for one of the Parabuthus species. And then it has got 3 faint lines, and this is a giveaway for this particular one. 3 faint lines, that's 1, that's 2, that's 3, you know, which run along the back of the scorpion. 3 faint black lines. It's distributed throughout Zimbabwe, and the venom causes great pain, and it's probably best managed in a medical facility. But there have been no documented cases of any fatalities after people have been stung by the scorpion. And then moving on, we've got Uroplectus, which also belongs to the same family Buthidae, and these are called the lesser thick tails. So it's like a miniature version of your Parabuthus species in essence. The tail is thicker than the pincers, and they're pretty small scorpions, which can be anything between 2.5 centimeters to 5 centimeters, although others have been purported to go up to about 7 centimeters. And when you look at them, they are pretty slender, whereas your Parabuthus was pretty robust. You know, they're quite fast moving. Normally come in dark green or green, like this one. I know it looks a bit black, but it's actually green with yellow, or sometimes you can get yellow ones with some dark markings across or along the body. Normally found under stones and bugs, and are actually extremely aggressive and when disturbed they will sting quite readily. So it's just like their cousins, the Parabuthus. But the good thing about these ones is, well, apart from a painful sting, with or without a swelling, chances are high that you will not have to be admitted with any form of scorpionism, because it may not go into that. Okay, so having said that, okay, about the Uroplectus probably is I'm moving on. It's also responsible for most of the stings that we have in Zimbabwe, probably would be as a result of Uroplectus, because they are widely found throughout the whole country, and your chances of encountering one, whether in a rural area or you know one of the towns, is actually much higher than coming across Parabuthus species. So stings from Hottentotta and Uroplectus species, they result in severe burning pain, which may last actually up to 2 days, believe it or not. And this may be followed by a dull ache for a week, a couple of days or so. and sometimes there might be some mild inflammation which occurs. So from our perspective as pharmacists, if someone is stung by these, they can probably be treated at the position of the pharmacy. So simple analgesia for pain relief may assist. But if perhaps with the Hottentotter, the pain appears to be too much, you can always refer to a medical facility. And then a cold compress can be applied immediately after the sting to try and localize the venom. And remember, we said the venom is largely neurotoxic. And then antihistamines have been shown not to have any effect on scorpion sting. So that's your Hottentotter and Georgioplectus. So moving on to the second family, which are the Scorpionids or Scorpionidae, the ones I've called the burrowers. And one way to remember these is that they've got these muscular, if I can use that word in quotes, claws, pretty robust. The tail is thin to medium. So because they are burrowers, you see, they need to have strong jaws to move the sand and also good claws to be able to dig with. And the feet, or the legs, not feet, the legs are also pretty robust so as to push the sand out. And the tail actually is a bit thicker so that you can also push the sand out of the burrows. So you'd find these in burrows which are normally oval shaped. And because they live in burrows, are not as common, especially the females, which probably spend most of their time there. The males might come out looking for females to mate with, but most of the times, the females would be hard to come across. So the burrowing scorpions, the genus is Opistophthalmus. They have pincers that are stout and rounded, as though they go to the gym, they work out. And when alarmed, some species make a hissing sound by rubbing the outer surface of the jaws against the hard edge of the carapace. So they make also a hissing sound and are found throughout, in Zimbabwe. We did make mention of one particular earlier on. So in terms of the stings, burrowing scorpions usually forage on the surface in the area immediately around their burrows. And humans are really stung, like I said earlier, because they spend most of their time in the burrows. And the stings can result in localized pain, lasting even up to a week. There have also been reports of mild systemic reactions lasting 8 to 24 hours. And if you recall earlier, I did mention that Bergman reported on a sting from one of the species in this particular genus. That's the Glabrifrons, Opistophthalmus glabrifrons, where there were signs of systemic envenomation. But most of the times, a simple analgesic should actually suffice. The last group, or the last family that we'll talk about, are the rock and tree dwellers, which are the Homoreans. And the Homoreans are cool because the sting basically has got no effects in human beings. So if you want to be all macho before your kids, you can handle one of these and look all macho. I'm joking, actually. So of the rock scorpions, so like we said, the Homoreans, it includes the rock scorpions as well as tree scorpions. So of the rock scorpions, they are the genus Hadrogens, and are very large dark scorpions, which can be pretty large, up to 21 centimeters, maybe even slightly more. And they live between rocks and barks of trees, and that's the reason why we said earlier that they are pretty flat. They are non-aggressive and rarely use their sting. And when they are resting in resting posture, like here, what we have here, the thin tail is normally curled up at the side like this. Those are your fronts. And then your tree scorpions, like I said, they are tree scorpions. This would be the genus Opistacanthus, which are also normally dark in color with an orangish tip. You can tell the tip is a bit lighter here. And they're smaller than the rock scorpions, and these can be about 10 centimeters. slow moving, and also non-aggressive. Normally live under bark of trees, especially acacia trees, which we have lots of those in Zimbabwe, as well as scrapes and rocks, and are often found hanging upside down from the overhead rock. So this would be your rock scorpions. So if you need to be stung by any scorpion, well, I would definitely go with the. So with regards to stings from homurids, the stings from homirid scorpions cause mild localized pain, and it's really mild. And it can last for about 20 minutes or so. There may be some mild swelling for less than 48 hours. And apart from this, nothing else really is expected. And if need be, then local analgesics would suffice in treating the scorpions. And then just as I conclude this particular lecture, it's already been about 30 minutes, just some cases which I took off the local media for students to actually have a look at in order to appreciate the importance of scorpion sting. And then reading perhaps this case that we hear of a 68, we hear of a 9-year-old who had visited a 68-year-old grandmother in a certain village in Zimbabwe, and the child was playing alone in the grandmother's yard, and then she suddenly screamed that she was stung by a scorpion. The grandmother rushed to the scene and saw a big scorpion. And when you see big scorpion disappearing into the grass, if it's big and it caused significant pain, then it would not be any of our rock scorpions, neither would it be the tree scorpions. It probably would be Parabuthus species, isn't it? And then we read that this child died a bit later. Although the story is really strange here because it talks about how the palm turned, that the child's hand turned black from the palm to the shoulder. I wonder if probably it was as a result of a tourniquet being applied, or perhaps misinformation. Another case of a 35-year-old who also was stung by a venomous scorpion and died. And this particular one, she was stung while she was putting a night dress on. And really from a safety perspective, prevention perspective, every time you're in an area where there are probably scorpions, it's a good idea for you, always before you get into bed, check your bedding before you put on your shoes. Check your shoes to make sure there's no scorpion before you put on your night dress or clothes. Just make sure that there's no scorpions in there. So she collapsed the next morning and died after having been stung by the scorpion. And this most likely would be Parabuthus transvalicus, given that this was coming from Mondoro. And then with your final one, a grandmother, 60-year-old. Remember what we said, the ones who are at risk are the infants or children, as well as those who are the elderly. And you have a 60-year-old who was also stung and died as well. And the interesting thing about this one is that she was stung. She was stung, on the stomach. And if you recall what I was saying earlier about, how the bite site is important. If it's closer to the heart and other vital organs, then symptomatology is going to be probably more serious. Prognosis will be pretty. Scorpionism is most likely to occur. And she was stung at night. Let me see. And probably whilst she was sleeping. So here's some interesting references, some good references for you to look at. Some very good materials that you can look at with regards to scorpion sting. I just hope that from this you have an overview at least of what scorpion sting is like in Zimbabwe. You read through these, you get some more information on the clinical aspects, but as an overview, I think that the material presented should be sufficient, that should suffice for you to be able to go out there and practice as good pharmacists. Until we meet again in another lecture, this is Prof Toxin saying God bless you, and we'll meet next time. Otherwise, God bless. Goodbye.